Thanks again very much to everyone for joining. Good evening, good morning, wherever you are. Welcome virtually to the Centre for Global Development. My name is Lee Crawford. I'm a senior fellow in our London office. I'm part of the rapidly growing team of us at CGD who are obsessed with lead. I'm sure I don't need to sell the importance of the topic to you all who you're here, but it feels like a really exciting time right now in the world of global lead exposure prevention. There's a lot of momentum and exciting action happening, and it really feels like it's an area where research can do a huge amount of good for the world. There are real constraints in our understanding of what the main impacts of lead are, what the main sources of exposure to lead are, and what the best strategies are to address that exposure. So we're really excited to have you all here, and to hopefully today we're going to make some connections between researchers who are looking for interesting projects that they can study, and with implementers who are out there on the ground trying to make change happen. So we've got a really exciting lineup for you of some of the leading organizations working on lead exposure globally. Our agenda is we're going to have a rapid round of quick 10-minute presentations from 5 organizations: Pure Earth, Vital Strategies, LEAP, USAID, and ADB. So not a huge amount of time for questions, but after those 5 presentations, we'll then move out into breakout groups. So you can choose which organization you'd then like to go and join a group to talk with about questions and about possible research ideas. So without further ado, let me pass over to our first presenter, which I believe is Gabriel Sanchez Ibarra from Pure Earth.
Thank you, Lee. Thank you for the invitation, and thank you for having organized this webinar. As you say, it's a very important moment for the lead ecosystem, and we are really pleased to be here and really thankful for having been invited. So I'm gonna try to share my screen. Please let me know if you can see the slides.
We can.
It's okay? Excellent. So the idea is to do a very general presentation about what Pure Earth is currently doing around lead issues. As some of you probably know, Pure Earth is a not-profit and environmental health organization that was created in New York City in 1999. So we are now reaching our 25th anniversary, which normally for a no-profit shouldn't be a good news to keep alive. We would like to disappear, but we didn't manage to do so. So we are still working, and since 2020 strategic plan approval, our main domain of expertise and work at programmatic level is lead and mercury. As probably you know, Pure Earth was born as an organization trying to tackle toxic pollution in general, and specifically dedicated and specialized on the identification and management of point sources through a relatively ambitious program for the identification of toxic sites and the cleanup of these toxic sites around the world. We are now an organization of approximately 100 staff across headquarters and 9 country offices, with a budget of 10 million per year, approximately, with 90% of this money goes to lead programming. And in the last 6 years, we have clearly moving from a much more broader pollution space towards a much more concrete and focused lead activity based on our experience and based on what we have been learning during our life as an organization. Excellent. So the way Purer start to generate knowledge and to generate activities about toxic pollution was with our toxic site identification program and our cleanups in different countries. As I was mentioning before, these toxic sites were polluted for several types of pollutants. We were not at that moment selecting pollutants in advance, but after more than 50 years working in this kind of settings and doing cleanups, we start to discover that lead was the most prevalent of these toxicants that we were trying to reduce in terms of exposure risk. And in addition to that, we discovered that 20%, so 1/5 of all these different toxic sites we were identifying and we were cleaning up were specifically related with ULAB recycling, with used batteries recycling. These kind of findings and this kind of analysis were happening at the same time that we were as well collaborating with others in the documentation and the calculation of the burden of disease related with pollutants, something that, you know, happened in a very important way through the work of the Lancet Commission around pollution, where for the first time was documented, clear, and state that lead was contributing more than any other pollutant to the burden of disease directly dependent or created by toxic pollution in the world. This moment was a kind of wake-up moment for the organization, and during 2017 and 2020, we start clearly to programming and to plan activities much more related with lead, and trying to document and trying to justify technically and based on health outcomes the decision that finally was made in 2020 on specializing the organization around lead and partially on mercury, but specifically on lead. One important milestone in this kind of evolution is this report that we released with UNICEF in 2020, the Toxic Through report, where for the first time, I think, or at least this is our own institutional narrative, some of the very staggering indicators we are using now, not only as Purer, but in general, as lead ecosystem are still in place. The fact that 1 in 3 kids has elevated blood lead levels in the world, that 90% of these children are living in low and middle income countries, and as well a much more broader understanding and accurate understanding about the potential source of exposure and the potential solutions. This gave as well as a result the attempt from us, but from other organizations as well, to start to compile all this information in something that was accessible, something that was easy to understand, but at the same time was showing in a very clear way the impact of lead pollution around the world, and specifically in the poorest part of the world, and the kind of consequences on health and well-being that this was generating, specifically among children and partially pregnant women. In 2020, in any case, was decided, and Purer made the decision of specializing in lead and try to set up or start to set up a specific approach in order to tackle lead pollution. This approach is what we call the five-phase approach. That is an approach that, of course, we didn't invent, but it's an approach that has been created following the experience of the countries that were doing this job since decades ago, specifically US, and trying to start to learn from this experience with the idea of setting up a sequential number of steps that, from our point of view, could permit and could allow to tackle lead in a holistic manner. So going beyond only toxic sites identification and cleanups, and trying to do something much more holistic and systemic in order to approach lead as a problem. These 5-step approach are more or less commonly known and are based on the fact of starting through health surveillance activities, trying to conduct baseline blood lead levels to understand prevalence and severity of this lead exposure. Along with these activities, trying to do source analysis in order to understand the most contributing sources on child poisoning in the different geographies where we work, trying to define and trying to plan source-specific interventions with the idea of mitigate the risk of exposures of the most vulnerable people, trying to work permanently in institutional strengthening, so asking the governments and working along the governments in the idea of incorporating all these data and all this way of working to the normal policies and service provision activities that governments are doing in low and middle income countries, and doing so, setting up and transversally communicating among the communities and the decision makers and the international actors around the findings, the recommendations, and the data that we have been generating over these years. These 5 steps approach for lead intervention are normally or undertake in groups and try to assure that what we do is based in data, in science, and what we try is to work prioritizing in a very clear way where to focus our interventions and where to focus the investments that we can do and the kind of work that we can develop with the governments in the countries where we work. In any case, the high-level outcome has been always measured in terms of reduction of prevalence of lead poisoning among children and pregnant and lactating women in the places where we work, and depending on the geography, we do that from a very public health approach, trying to specifically focus on health outcomes, not necessarily in environmental outcomes or environmental pollution as such. What this has given as a result is a series of different activities in different countries, depending on the moment, depending on the appetite of the different governments, and of course, depending on the needs and the financial capacities we find in the different countries where we work. We have been supporting blood level testing, both at local level, in some cases regional level, but as well at national level, working with partners and working with national authorities in Bangladesh, in Colombia, in Georgia, in Ghana, in some states in India, in Indonesia, in Kyrgyzstan, in Peru, and Philippines. Some of these blood level testing activities has been already done and finalized. Others are ongoing, and others will be executed during 2025 with specifically with our colleagues of Vital Strategies that are working with us in some of these contexts on national representative blood level surveys. Along with the homes-based assessments, we have been with blood level testing, we have been doing as well homes-based assessment as the way of trying to identify the main contributing sources and household level, and trying to do assessment of main contributing sources in the different places where surveillance activities has been implemented. But we are using as well other kind of exposure source analysis, such as rapid market screening that took place between 2022 and 2023, and supply chain analysis in 25 different countries, and testing more than 600,000 items in all these different geographies. And of course, we continue as well putting attention on toxic size assessment and identification, specifically for lead in the majority of the countries where we work. Once this data is generated and we have a clear idea about prevalence and about main exposure sources, what we try to concentrate is in the priority source-specific interventions that we think will have the biggest impact in order to reduce global exposures. And this depends a lot, as you know, of the results of the different host-based assessment campaigns we have been doing and in the different exposure patterns that we find in different countries. In fact, we have been working specifically in ULAB in 3 main contexts, Bangladesh, Ghana, and Indonesia, in the last 3 or 4 years. We have been starting to work and collaborate with governments in spice adulteration activities in Georgia and northern India. We are very focused on ceramic cookware glazed with lead-containing paints in Mexico. We are starting to explore the possibility of working in cosmetics in Ghana after the results that we obtained, that we got from blood level surveys and host-based assessment in the northern part of the country. And we are starting to explore as well aluminum cookware interventions in Tamil Nadu, India, but as well in some other places where we are still in the phase of supply chain analysis and rapid market screenings, where we try to understand the level of severity of lead concentration in this cookware and the potential leaching mechanisms contributing to lead poisoning. In terms of institutionalization, what we normally do is to try to expand the work on the setup of monitoring and surveillance system. And this is where we work again with vital strategies in Colombia, in India, in Indonesia, in Kyrgyzstan, and Peru, but as well in Philippines, where we have been doing some important steps forward in the last years. And we work as well in regulatory activities for specific sources in the majority of the interventions I was mentioning before: spices, ceramic cookware, cosmetics, or aluminum. The places where we work now that are there in orange is in 9 countries, 3 in Latin America, 1 in Sub-Saharan Africa, and 4 or 5 in Asia. And the areas where we are trying to expand our activities in the coming 2 years in a pre-planning process with different donors is in Brazil, in Eastern and Southern Africa, in MENA, through Egypt, and as well in Nepal. This is what I wanted to tell you as an introduction. Thank you very much.
Perfect timing, Gabriel. Thank you very much. So moving on, next up, we have, I believe, Yi Lu, the Senior Program Manager from Vital Strategies. Are you there?
Yeah. Hi, Lee.
Yes. Hi, welcome.
Thank you. Let me know if you see my screen.
Yeah. Yes, we got it.
Okay, great. Thank you, Lee, and thank you for the invitation. Again, it's great to have this opportunity to meet you all and share a bit about the lead poisoning prevention work we do at Vital Strategy. As Lee mentioned, my name is Yi. I'm leading our lead poisoning prevention program at Vital. But along with me here is also Dan Cass, who is our Senior Vice President, who leads our environmental, climate, and urban health portfolio. Some of you might not know about Vital Strategies. We are a global public health organization. Overall, you can see this triangle shows what Vital Strategies expertise are. Overall, our approach is to work and partner with the governments in different parts of the world and help to design rapid and implement public health systems that bridge the gap between public health and needs and solutions. So for a Vital Strategy, we're only one of the many public health portfolios that we have and topics that we work on. So Vital Strategy currently are in more than 80 countries. We work with both national but regional and city governments on public health topics. And as you can see here, We work on environmental health topics such as air pollution and lead poisoning, but also on some other important public health issues such as alcohol and tobacco control, but also public health data strengthening. So I think one of the questions that brings everyone here is why do we want to work on lead poisoning prevention? And as Gabriel and all of us have known, that lead is really a leading and preventable risk factors that are not just affecting children's health, but also their opportunity to succeed in the future. And as we all know, Vital particularly care about the risk factors that are affecting vulnerable population, but also causing health inequity. And lead exposure often affects population and communities who are already at disadvantage with also brought a lot of experience working on and leading the lead poisoning prevention work at New York City before he joined Vital Strategies. And lead poisoning was also surfaced as a very important topic that the government partner who wanted to tackle while they were working with us on other public health issues at Vital. So this is the current country profile that we work on we work on lead poisoning prevention. And we can see that we have Peru, Indonesia, India, and particular 3 states in India, Philippines, Colombia, Kyrgyzstan, and China. Our work started from Peru, but it's expanding pretty quickly. So these are a couple of the areas that we as Vital focus on. We're a fairly small program compared to peers, but there are several areas that we focus on addressing on lead poisoning prevention. So first of all, the major expertise that we bring in is working with the government on designing the blood lead surveillance system at national or regional level. And during this process, we also we do conduct the blood lead testing, but also using a risk assessment questionnaire where we try to understand what are the risk and protective factors that related to lead exposure during this process. And these data then can be contributing to integrated database that help the government to understand what is the distribution of lead exposure in their population and what might be some of the high risk areas that they need to prioritize interventions and policy actions. Well, the key approaches that Vital have been used across all our program is the engagement with government and also the public health system strengthening. So during our process, we try to push for government-led efforts by forming government-led working group and engaging them in the design of all the project and tools that we're developing. And also we have worked with local government to also help them to develop, particularly in Indonesia, local action plans that the government can use to tackle lead poisoning in their communities. We have also worked with governments. One thing we noticed is that many of the countries does not have a national guideline or clinical guideline on lead exposure management. And while WHO already have a WHO guideline, this has not been adopted or established in many countries. So one of the things we did was with Peru and Indonesia government, we helped them to adopt the WHO guideline. But in there, many countries are very limited in their testing resources. So one of the things that we incorporated is to include a risk assessment component where the government can prioritize testing resources to children who are at high risk compared to others. And for helping the health professional to implement the clinical guideline, we have also developed a training for the health professionals and medical students. And one other thing component that we have worked on is raising awareness related to lead poisoning in impacted community. So in Indonesia, what we have done is to assess the knowledge about lead poisoning in 2 impacted communities, and also developed a communication campaign to educate them on the sources and the actions to reduce their lead exposure. So this is just kind of a full picture of how we put different components we work on and how we try to enter a country and then do it in a more comprehensive approach with the government to address lead poisoning. But here I just want to quickly show that when we talk about our blood lead testing or surveillance efforts, this is how it often looks like in many of the countries for now. We have been collecting capillary blood sample and then use lead care to test them. But meanwhile, to validate these tests, we also collect a small subset samples of venous blood sample and then send it to the laboratory. And as our Pure Earth colleague mentioned before, we also through collaboration with Pure Earth, we also refer a subset of households that Pure Earth will also then conduct the visit to their homes and collect environmental samples to assess lead in these environmental samples. And as we have a lot of academic researchers here, we also did a quick kind of brainstorming on what might be some opportunities for us to collaborate. And so these are a couple areas we thought, first of all, during the blood lead testing and surveillance, this could provide data for researchers to think about, to use to develop effective and location-specific risk screening tools. If we think about CDC, data could also be used for, validation of spatial extrapolation, and then also for multi-center data analysis and comparison. And also during the field visits, this also allowed pairing with other opportunities if, for example, collection of environmental samples from households that might indicate the source of lead exposure. We mostly just collect capillary blood sample or venous blood sample, but this could also create an opportunity for collecting non-invasive biological samples that indicate lead exposure and compare it with the lead exposure in blood. And the questionnaire also is a tool that can allow additional assessment of other potential relevant factors that relate to lead exposure. And as I mentioned, we do collect a small subset of venous blood sample, which also could be used for measure other measurements. And our health education also provides some other opportunities to incorporate tools and technique for training. And this is just a quick summary of all the partners and funders that have funded our lead poisoning prevention work. And at the end, sorry, I just wanted to show this work has been done by an amazing team all together. So thank you.
Thank you very much, Yi. It sounds like really great work that you guys are doing. So thanks, everyone. We are halfway through. Unfortunately, the Albert Park from ADB hasn't been able to make it. So we have 2 more slots. First up, Juliette Finetti from LEAP, which is the Lead Exposure Elimination Project. I think I've got that right.
That's right. Thank you so much. Hi, everyone. Thank you very much for being here today. I'm very excited to be part of this event and hear ideas that researchers have for partnering with us. My name is Juliette Finetti, and I'm the Director of Research and Strategy at LEAP. Today, I'll be talking about LEAP's program and research priorities. So LEAP was created in 2020. It's a little over 4 years ago now, and has so far been really focused on one core program, which is to eliminate lead from home paint in low and middle income countries. Our main approach is fairly simple and it's twofold. One, we support governments to regulate and enforce laws around the use of lead in paints. And two, we support manufacturers to switch away from using lead materials. Just to give you a sense of the scope, the scale of our work, we currently work in 31 countries across Africa, Latin America, and Asia. And 11 of those countries were programs started last year. We've completed studies to identify and measure the level of lead in home paint in 18 countries. We've had some encouraging results so far with suggestive evidence that 50% of the lead paint market is in the process of switching away from lead materials in a total of 10 countries. In one of those countries and several more of them, it's a work in progress. We've done a follow-up study and have confirmed the manufacturer's reports. So how do we achieve this and how do we work? Our program can sort of be broken down in 5 main steps. The first one is we identify and engage the relevant government authorities, inform them of the problem of lead exposure through paint, offer our support, and usually sign an agreement that will sort of outline how we will work together. The second stage, as I mentioned, is we conduct a paint study to determine whether and to what extent there is lead on the home paint market. After that, we bring those results to our government partners, and it's step 3. We try to support our government partners to introduce or improve current regulation around lead paints. Simultaneously, we also engage with the industry. That's step 4. We provide support to manufacturers to help them reformulate their paints. And finally, we conduct follow-up studies to monitor our progress and better tailor our support for more compliance, more enforcement and compliance. So what's next for us on the paint program? I've outlined a few of our goals for next year here. In terms of continuation, we plan to, of course, continue to push for change in the countries where we're currently operating. And we'll also aim to expand and apply our model to 10 new countries. In terms of new goals, we are entering a new phase of our program with a lot of countries. We find that in a lot of countries, manufacturers are starting to switch to lead-free paint. And so it will be really important for us during this transition phase to monitor what's going on and make sure that all manufacturers are following through, as well as make sure that manufacturers that have switched to lead-free don't go back to procuring lead-based material. And in the last 4 years, we've also learned a lot about what are some of the strategies that help us achieve change faster. And so next year, we'll want to test new approaches to improve our program and achieve more impact. In light of goal 3 and 4, we still have some open questions that might be of interest to some of the researchers here today. For example, we're interested in learning more about how we can effectively support enforcement. Should we be providing more training or testing capacity building? How can we better promote compliance? For example, could we engage more with the media to create incentives for manufacturers to switch to lead-free materials faster? We're also quite interested in learning how to address lead use in the informal paint sector, as in some countries, the informal sector can add up to a significant share of the market. But as you might imagine, it's quite resource intensive to reach a large number of small manufacturers. There are some other questions that I've outlined here, and happy to talk more about them in the Q&A, related to market dynamics during the transition to lead-free and the impact of eliminating lead from industrial paint. So besides paint, our goal for 2025 is to pilot interventions that address lead exposure from other sources. We have done a little bit of this work before, but haven't, allocated large resources to other products, and we'd like to do more of that in 2025. We are very keen to identify products that on which the lead issue could be addressed through a similar model to what we've built expertise doing. So, working with government, regulating, and working with manufacturers, helping them to find alternatives to lead. The challenge with many consumer products is that there is some evidence that there is lead above reference levels in those products on the market, but their relative contribution to blood lead levels in LMIC population is not so clear. So how we've addressed this so far is we've tried to kind of review the evidence on different products and try to assess them systematically against a set of criteria. The criteria that we care about include feasibility, so how easy it is going to be for LEAP to make progress on the issue, evidence base, scale, and cost effectiveness. So we're still very early stage in our prioritization process, but some of the products that we think would be really promising to work on include traditional eyeliners, plastic footwear, spices, and Ayurvedic medicine. If you are interested in learning more about, why we think those are promising or what our remaining questions or uncertainties are about those, happy to talk more about it in the Q&A. And through our literature review, we've basically identified quite a few areas where we think that more research would be really valuable. So I thought I'd just give a brief overview of that, as I think it could be useful for researchers to see, what is some of the evidence that we as implementers would really benefit from and would help our decision making. So in the space of sort of lead content studies, there's large literature identifying the problem in specific products, but we find that there are few studies trying to quantify the problem at a market level, which can be hard to know, how big of the problem is this at scale. There are a lot of studies where samples are drawn from high-income countries or might be drawn from in a non-random fashion. And so I think having more representative market studies would be really helpful. There's some really informative studies, for example, on traditional eyeliners, cultural powders, and Ayurvedic medicine that are manufactured in South Asia and sampled in the US. And so those studies have been really helpful in sort of revealing that this can be a significant issue. But as you might imagine, goods imported in the US might undergo more scrutiny. And so the share of the market that's affected by the problem might not be representative of the South Asian market. And we might care a lot about that as well, given that South Asian populations might be using these products even more frequently. So these are some kind of examples of things that we would find really helpful to see more research on. The second area is sort of lead intake. So there might be significant evidence that there is lead in a product, but it's unclear how much that translates into lead in the body. And as we all know, this kind of depends on user behavior. So how much of the product are people actually consuming and how frequently, as well as things like leachability. So for example, Pure Earth conducted the rapid market screening study, which provided a wealth of information around the world on the presence of lead in different products and revealed that over 10% of plastic products have high lead content. But across all the research that we've looked at, we've only found one study that speaks to leachability of lead from plastic. I'm just gonna skip to the next slide for time. So what are going to be our research priorities at LEAP is really just filling those gaps on the causal chain to impact for our top non-patent sources and use the findings to update our cost effectiveness and impact estimates and further prioritize which product we want to focus on. And what this will look like concretely is two types of studies, descriptive and impact studies. On the descriptive side, we're really interested in more rigorously estimating the market share affected by the use of lead in certain products. We're also interested in conducting consumer behavior surveys to better understand how much and how frequently people are exposed to a given product. And those are sort of like quicker studies that will help us, improve the parameters that go into our impact calculation and prioritization. And then in terms of impact studies, just as we do for paint, we're always interested in learning what the effectiveness of our intervention is on at least intermediary outcomes. So we'll be looking at what is the effect of our work on the market share of the products that contain lead. And if we do more work on the demand side, we'd also want to know what the effect of our intervention is on consumer behavior. And very open here to consider experimental designs. And we're also really interested in doing more work on the effect of our program on BLL impacts and assessing the impact of different sources on BLL in the population in the countries where we work. I think I ran out a little bit of time, but just wanted to say we're very open to partnering with researchers. So if any of those topics sound align with your research interest, or if you have other ideas that didn't mention in the presentation, but that are aligned with LEAP's priorities, we'll be very open to hearing about them. Thank you very much.
Thanks very much, Julia. That was fantastic. So we have one more presentation from USAID. The trouble with working on lead is that you don't know if someone is the lead coordinator or the lead coordinator because of the word. But welcome, Nida Parks and Casey Bartram.
Thanks so much. And thanks for presenting the slides, Casey. All right, so hi everyone. Nice to see many of you again. I'm Nida Parks. I sit in the Global Health Bureau here at USAID, and whether it's LEAD or lead, have helped to move our lead exposure work forward, along with Casey and others on the team for the past number of months. Go to the next slide. So we will kind of rapidly go over what USAID has been up to, some country-specific activities, and then I will pass it over to Casey to talk about kind of the research gaps and opportunities as we see them. Next slide. Oops, one back, I think, yeah. Okay, so I think what kind of started about a year ago as more of a what we call a kind of progress beyond programs, where we kind of use our USAID convening power on the ground and globally to help move or highlight an issue and move it forward. So I think that's kind of how we at headquarters, along with our USAID missions, first mobilized most recently around lead exposure, was trying to see, who could they convene with, in terms of government stakeholders, who could we connect in terms of technical experts and implementing partners to help just bring the issue of lead exposure up on people's agendas. Over the course of the year and at the launch of our Partnership for a Lead-Free Future, which I'll talk about in a minute, we at headquarters and also at the mission level found ways to put funding actually toward this issue. So we were able to focus on kind of more concrete activities. And actually we can go to the next slide now. For example, this is kind of a menu where you can see across countries. So we have USAID missions in each of these countries. What kind of activity is being supported with either USAID funding, or some of this is still kind of just our on the ground folks helping to keep these conversations going. For example, in Ethiopia, we've had great success through our health office and working with the Minister of Health to convene across other ministries to really make an agenda for lead exposure. And so there you can see it kind of ranges from the measurement side, so on supporting the expansion of BLL testing in existing surveys, adding on the source detection component where possible, and then kind of landscaping and technical assistance more broadly across these countries. Next slide, please. We also have focused on kind of headquarters opportunities. LEAP, who you just heard from, is now a USAID partner And so together we're supporting work in about 30 countries to continue the good work you just heard about from Juliette, specific to paint. That's the name of the project there, the Global Switch. And then as you heard about comprehensively, that has to do with working closely with governments and manufacturers, and making sure that at the end of the day, these interventions are country owned. And so we're really excited about this new partnership between USAID and LEAP, and look forward to really driving some results in that area over the next couple of years. Next slide, please. And then finally, hopefully many of you are aware, but in partnership with lots of you on this call, but with UNICEF as kind of the driver of the Secretariat, we launched the Partnership for a Lead-Free Future at the UN General Assembly in September. We're able to really, by that point, create a really big base of partners, both on the country side and also on the non-government side, foundations, NGOs, research institutes, again, represented by many of you here, to come together so that by the launch, we were able to really to make it clear that there was already a great movement to addressing this issue globally. So there's lots of work. It's meant to be a 5-year initiative. Right now, we're kind of in the systems, processes building stage, making sure that as this goes forward, it's really fit for purpose. And again, with great thanks to UNICEF there for their leadership for the Secretariat. And I think that's my last slide, and I will hand it over to you, Casey. Thanks so much.
Thanks, Nida. I'm going to really quickly build on what Nida shared on USAID activities and discuss what is known about lead poisoning in a global context and what information we're lacking. And then end by suggesting some opportunities and strategies, really overarching things that I think might help even as we move into the discussion today. I'm going to attempt to cover what's known about lead poisoning in 2 slides, which is ambitious, as most of you know, because we know more about lead than any other contaminant in the world, including information on health, education, and social impacts, that early life exposures are most critical, and that prevention really is key. And we know so much about lead that scientists have this ability to predict blood lead levels in countries around the world, which is what several researcher groups have done, including IHME. And this map is presenting that data. And it really highlights, as we all know, the burden of lead poisoning being greatest in low and middle income countries. We also know that sources, of course, vary between and within countries, and there's likely multiple sources of exposure in any one country. And this ranges from industrial emissions to battery recycling to paint, cookware, cosmetics, the list goes on. One thing that isn't always intuitive for people that I think all of us have a responsibility to keep in mind and remind the general public and the partners we work with is that the major risk factor for lead exposure is ingestion. And this is, again, not something that people often think about, but lead most frequently finds its way into bodies, especially kids' bodies, because it's ingested. Inhalation is certainly a risk in certain settings, but really we're talking about ingestion as a major risk. And so we need to be able to identify which of all of these sources on the screen are poisoning people in different countries and how they're getting into people's bodies, and at what frequency, which is something that's been raised by a previous presenter as well. One of the ways that we can identify possible sources of lead is with handheld technology called an XRF, or an X-ray fluorescence spectrometer, sometimes called a PXRF for portable. These give nearly instantaneous results on lead concentrations, and that makes them incredibly useful for identifying all those possible sources that I had in that previous slide. Through an event called 17 Rooms that USAID helped sort of develop, but it was hosted by the Brookings Institute. We were able to gather a cross-section of stakeholders and develop a strategy for increasing access to this very device, especially in low and middle income countries where that lead burden is so high. And the outcome was a plan for developing a global hub for XRFs that offer low-cost, long-term leasing or purchasing options, and most importantly, training, because it's really easy to use these devices, but understanding how to interpret the results and take those forward into policy and regulatory frameworks is a little bit more difficult. And so this is a way to support governments, especially in low and middle income countries, to build their capacity in source assessment. One more thing that I'll just touch on, because I know that we're getting low on time, is this work that we did under a funding mechanism at USAID called INVEST, looking at the supply chains and value chains for lead in both consumer products and the used lead acid battery markets, formal and informal, in 3 countries, Mexico, India, and Nigeria. This has really helped inform us quite a bit in terms of thinking about how to start tackling these problems on a national or even global scale. And we can certainly share out this report. It's publicly available, and that's probably all I have time to say about it. But it has been very helpful. I want to move now into the unknowns and what we don't know, which is surprisingly quite a bit, considering how much we know about lead toxicity. There's some crucial pieces missing. I would say the overarching one that influences many of these subcategories is just awareness and political will. Those are the obvious ones that need to change in order to start taking on some of these problems at national levels. Relevant to this group today, we're missing some key pieces of information that could really help increase awareness and momentum. One of them is there's few nationally representative blood lead surveys out there. The caveat would be that there is inclusion of blood lead testing planned in both UNICEF and USAID national survey activities in the coming years, which is very exciting, but there's gonna still be more countries where we don't have data than where we do. Even more important than the lack of blood lead data is a lack of an understanding of which sources are contributing to lead exposure in which populations, because it's great to know what the burden of lead poisoning is, but you can't do anything about it until you understand the sources. And so really the trick here is to understand those sources to be able to prevent the exposures. And that's something that we just don't have a lot of information on. There are some low resource tools that can help answer some of these questions. That includes the Lead Care 2, which is a point of care testing device for blood lead levels, as well as the XRF, which I showed on a previous slide. Those are really useful tools for screening and identifying and making rapid decisions in the field. These aren't always widely accessible, and they aren't always applicable depending on the goal of the project. And so there's certainly some places there where there's opportunities to do more. Which moves us into the needs and looking forward, some suggestions to take forward. Understanding which sources are dominant in which areas. And actually backing up before that, I wanted to say that research to action is so important here. So making sure that all of the research in this area is being done to really be practical and inform next steps in intervention. So understanding which sources are dominant in which areas, which tools are most helpful in assessing lead exposure. And by tools, I don't just mean technology. That can be questionnaires to understand lead exposure sources, which have mixed success here in the US, and understanding how useful, if at all, those can be in other settings is something we don't know. So tools is a broad category. Where are there opportunities for new technologies? Understanding what makes interventions effective and sustainable, going back 5 or 10 years later to see what's happening and what can be improved upon an intervention, and understanding how testing could be made more accessible to regulators in these countries. Another overarching theme to take forward is that research really needs to be designed, implemented, and the results analyzed hand in hand with governments in these countries. If in-country leaders are going to own the interventions that are needed, they really need to be involved in stage 0 of developing those investigations, participating in them, leading them. And that's something I think that we can all continue to work on improving. So not involving them once the data is generated, involving them well before that step. And finally, of course, addressing known sources. There are many situations where more evidence is not needed. We know that if there's a battery recycler that's operating in a way that is unsafe and is polluting the community around it, that's something that needs to be addressed. We don't need a study to do that. And so as a scientist and as someone, as a researcher, I understand this desire to have more information and more evidence. And I think it's obviously a powerful tool, but at the same time, what is it that we can be acting on now with the information that's already available, and how can we do that better? With that, I think I'm ready to pass it back over. Thank you all very much.
Thanks very much, Casey. That was great. So now we have a few minutes left if anyone has any burning questions before we break.